Welcome to the 2022 TPA Board of Directors Candidate Forum. The Texas Pharmacy Association Nominating Committee, chaired by immediate past President Michelle Bell, selected this slate of candidates from the many nominees put forth by the membership. This presentation is designed to help you learn about the candidates and what they hope to accomplish if elected to the TPA Board of Directors, as well as their vision for the future of pharmacy in Texas. TPA members eligible to vote will receive their ballot via email on Monday, July 18th, with the ballot staying open through Monday, August 1st. Now, to meet our first candidate for President-elect, Jay Beesh.
My name is Jay Beesh, and I appreciate the opportunity to be able to visit with you for a few minutes, share a little bit about myself, and also tell you why I'm interested in the opportunity to serve as the next president-elect of the Texas Pharmacy Association. I've been a pharmacist for over 27 years and currently reside in New Braunfels. My day job is as Senior Director of Pharmacy Managed Care at HEB. Some of my current responsibilities in that role include business development and relationship management with PBMs, health plans, and other key stakeholders. Our team supports our stores with operational issues such as contracting, audits, and claim building problems. And then I'm also heavily involved in our advocacy efforts. I spend a lot of time, particularly on payment policy issues related to Medicare, Medicaid, PBMs, DIR, for example. But I've also been heavily involved in our efforts to advance the profession, such as expanding immunizations and other types of services that we can offer as a profession. As far as my role in TPA, I've served the board for the last 6 years, currently as a vice president, but I've also held roles of treasurer-elect and director. Beyond wanting to just continue to serve the association, my desire to be president-elect really involves, what I believe is a generational opportunity we have to transform and improve our profession and our industry. What our pharmacists and technicians are doing in this state, serving Texans on the front lines, is nothing short of heroic. And I believe they deserve our best efforts in advocacy to make sure that they can practice at the top of their license with little interference from PBMs and health plans, and also the ability to earn fair reimbursement. None of this is necessarily going to be easy. It's going to take a lot of work at Capitol and from a regulatory perspective, but I really welcome the opportunity to be part of telling that story over the next few years. I would also welcome the opportunity to, as president-elect and ultimately as president, to be able to represent the TPA board and ultimately lead it. A few key traits that I think I'd bring to this role include the ability to build consensus. While it takes a lot of time and effort and it's not easy, I think that building policy based on consensus is ultimately going to be the best lasting, strongest approach. Over the past 15 years, I've worked in this industry on a daily basis, and know the various players, various associations. And I believe that, the ability to work with everyone to achieve, if not unity, at least a singularity of purpose to move our profession forward and make it better. Another characteristic I bring to the role of president-elect is a passion for advocacy. Again, I want to be part of telling our story, the story that will propel our profession into the future. What we're working towards is not easy. We're going to face setbacks, but I know that we'll win because we have a desire to keep our profession thriving for generations to come. It is important as leaders of TPA that we continue to incite young pharmacists and technicians to develop the passion for advocacy and to make it a lifelong focus. They will not have the luxury that I have had of sitting on the sidelines for a number of years, knowing that others would take up the torch. We need more voices and we need stronger voices to achieve our goals. Finally, I bring over 15 years of experience in association leadership, having served on the board of a number of organizations and associations, including as president of the Texas Federation of Drugstores and, of course, my time with TPA. I'll bring a high level of experience in organizational leadership. Beyond that, my frontline experiences, my daily job, if you will, I believe continue to bring other experience to the association. Thank you very much for your time and consideration.
For President-elect, Leanne Hampton.
Hello, my name is Leanne Hampton. I am applying for TPA leadership. I've worked in a pharmacy since I was 16 years old. I graduated from Texas Tech in 2002. I returned home to rural Northeast Texas and began working with James Paul Myers, past TPA president. He taught me much about pharmacy, owning a business, and professional advocacy. Myself and Leslie Lang purchased Paris Apothecary on Independence Day, 2007. Pharmacy has treated me well, and it's time to give back. The pandemic showed pharmacy's worth. In my case, my store provided masks to teachers, made around 1,000 gallons of hand sanitizer to fill the gap during the shortage, added COVID vaccines to our vaccine protocols and COVID testing to our point-of-care testing programs. We developed policies and procedures to provide safe areas to administer over 1,000 doses of antibodies for those with COVID and high risk of complications, all while maintaining our everyday practices. There was no virtual resources for pharmacy. We had to stand the line and not only bravely continue our daily work, but expand our profession to meet the need. We are COVID heroes, but our work isn't done. We must advocate for our profession and with a united front. It has been my honor to serve as a current TPA board member, past GAC member, past Awards Committee, Affairs Committee, and Policy Council member. It was the absolute highlight of my career to be recognized as TPA's 2021 Pharmacist of the Year. But our work isn't done. Pharmacy has the history of being splintered, but during these unprecedented times, we are becoming united. We must continue on and preserve the honorable profession for the next generation. If you choose me to represent you, I believe we must continue the PBM reform and unity of our profession. PBM abuse affects all of pharmacy. We must free ourselves of their tyranny. We must prevent them from cheapening our profession and mold our profession into what we want it to be. My vision aligns with TPA's to unify, strengthen, and protect the profession. To take care of our patients, we must take care of ourselves. Patients deserve quality, personable health care. Thank you.
For Vice President, Joby John. For Vice President, Adam Chesler.
My name is Adam Chesler, and I'm asking for your vote. My entire career in pharmacy, I've focused on advancing the role of the pharmacist and technicians. From working in Walgreens and Target, doing retail pharmacy, strategic alliances at PTCB, legislative and regulatory affairs at Cardinal Health, and now as the Senior Vice President of Pharmacy at Village MD. Each of these career choices was taken because of its ability to expand the scope of the pharmacy team in healthcare. The future of pharmacy for our pharmacists and technicians is bright. We have entered a new era of healthcare where pharmacists and technicians can be a critical piece of the healthcare spectrum. New reimbursement models are allowing pharmacists to be reimbursed for improved outcomes with no provider status needed. In fact, the shift in healthcare is proving to physicians that pharmacists aren't directly competing, but are instead complementary assets to their team. Pharmacists should not be worried about putting pills in a bottle. They should instead be focused on counseling patients on their therapy, triaging care gaps such as blood pressure, A1C, initiating statin therapy for diabetics, treating minor ailments like UTIs, reducing readmissions through transitions of care, and guiding patients along the care journey, especially those that have mental health issues or they're an underserved population. Pharmacists should be completing annual well-care visits, operating disease state management programs to improve outcomes and lower overall costs of care. I know these things are true, and it is my goal in this role to create pathways for pharmacists and technicians to do this and more.
For Treasurer-elect Aaron Gibson.
Hello, my name is Aaron Gibson, and I'm a pharmacist. I graduated pharmacy school at the University of Texas at Austin in 2004. Continued my education there, did a specialized residency in psychiatric pharmacy, as well as received a master's in pharmacy practice and administration in 2007. My first practice setting was actually in academia. I worked in a clinical setting at the University of New Mexico College of Pharmacy on the geriatric psychiatric unit at University Hospital. And I also taught, was in a tenure track position there at the University of New Mexico College of Pharmacy as well. Currently, I'm the owner and pharmacist at Prescription Shop in Andrews, Texas. That's one of the stores I own. I own 7 different stores throughout West and Central Texas and South Texas. Most of them, and in fact all of them, are in rural parts of the state in small towns throughout West and South Texas. The reason for me applying and running for this position at the board of directors is that I realized several years ago that if we don't advocate for our own profession, no one else is going to. And that's why I would like to join the TPA board of directors in this role in order to provide a voice for our profession. If I'm elected, my primary focus is going to be to grow membership of pharmacists and pharmacy technicians in TPA. I'd really love for our numbers to swell to match the numbers of doctors in the Texas Medical Association. I believe there's strength in numbers. And if we don't grow our profession and protect it, we're going to slowly see it erode. And so I'd really like to see growth in our membership in Texas Pharmacy Association. I think there's a huge opportunity for that, and I think it's vital to our profession going forward. My vision for pharmacy in Texas going forward is kind of twofold. I'd love to see a unification of our voice as pharmacists across settings and across practices. I really think that that's going to be key. Everybody working together in a unified voice will be key for our profession going forward. And the second thing is also to expand the services that we're able to provide under our license. I believe we're not utilizing what we're trained to do adequately currently, and I'd like to see that expand as well. So that's kind of what I'd love to see happen is the expansion of our capabilities in pharmacy practice across Texas. Thank you for your time and your consideration.
For Treasurer-elect Lauren Corrales.
Hi, I'm Dr. Lauren Corrales. I'm originally from Austin, Texas, currently in San Antonio. I've worked for Carvajal Pharmacy since 2012 and am now a pharmacist at our long-term care pharmacy. I'm also serving as our program coordinator for the ABCES accredited diabetes education program. I'm president of our local Bexar County pharmacy organization and also a member of the TPA House of Delegates. I look forward to using my leadership experience to continue advocating for our profession. One of my goals is to increase TPA membership. The more pharmacists we have advocating for our profession, the better. Especially right now, it's a really exciting time for pharmacy with everything going on in legislature. So I look forward to using this momentum to continue advocating for our profession. Another one of my goals is to raise funds for TPA. We are going up against these PBMs with ridiculous amounts of money, so every penny counts, and I'd like to take advantage of any fundraising opportunity that we can. And finally, reaching out to our pharmacy members. So reaching out to our local pharmacy organizations, making sure that their members are also involved at the state level and advocating for our profession, and also reaching out to our future pharmacists. So reaching out to the schools, making sure the students are aware of what resources are available to them and how important it is to advocate for our profession. Encourage them to reach out to their local state representatives, not only now, but also when they graduate. I think we need to stress the importance of staying involved with TPA and continuing to advocate through for our profession. We have to remember we're not just fighting for pharmacy, we're fighting for our patients. Our patients deserve the right to choose where they want to fill their prescription. Our patients deserve the right to access affordable, quality, accessible healthcare that pharmacies can provide. We just have to continue advocating. I think it's really important that the patient sees us pharmacists as someone more than just someone that's behind the counter, but someone that's fighting for them, that's someone that's advocating for them to get them the best quality healthcare that they deserve. I'm Dr. Lauren Corrales, and I hope I can count on your vote.
For Director, Position 1, Christine Hong.
Hi, my name is Christine Hong, and I'm currently the pharmacy manager of an HEB pharmacy in Waco. I've been with the company for nearly 7 years now, and I'm also a pharmacy preceptor. Within TPA, I serve as a council member of the Public Affairs and the Association Affairs Councils, and it's my second term doing so. Throughout pharmacy school as a student pharmacist, I've also been involved in TPA. I was their student pharmacist intern, and I also served as TPA's vice chair of their policy standing committee. I am also becoming more involved on the local level by joining the Dallas Area Pharmacy Association, and I've kept my national involvement through APHA. Within APHA, I'm the committee chair of their advocacy committee, which is a part of the Immunizing Pharmacists Special Interest Group. Within that committee, I've led the drafting of our new business item, which actually got selected by APHA's executive committee and has been selected to proceed on to the House. My other professional memberships include Phi Delta Chi, Phi Lambda Sigma, Phi Delta Chi's Texas Alumni Chapter, and the Texas A&M College of Pharmacy's Alumni Association. Why I want to serve on TPA's board of directors go back to just TPA providing guidance and resources to me, not throughout my time as a student pharmacist, but especially during my time and still now as a new practitioner. I would love to use this platform as a board director to contribute to TPA's advocacy efforts and focus on membership. I would like to focus on new practitioners like myself and student pharmacists primarily, and help grow TPA's association that way so that we can really have that strength in numbers to push for different efforts that we do in all aspects of pharmacy. For the future of pharmacy, my vision is for all of pharmacy to be united under our state association, which is TPA. And I would like TPA's voice to be very clear and focused, and to also ingrain advocacy in our student pharmacists and new practitioners, because by doing so, it ensures the growth and protection of our profession. Thank you.
For Director, Position 1, Jeremy Ashley.
My name is Jeremy Ashley, and I've been a licensed pharmacist in Texas for almost 14 years. I was born and raised in rural East Texas and graduated with my PharmD from the Texas Tech University Health Sciences Center School of Pharmacy in 2008. Upon graduation, I began my pharmacist career in the retail setting. I had the privilege of working for HEB Pharmacy and served in many roles there, including floater and staff pharmacist, corporate management, and pharmacist in charge. After much prayer and the need to move back to East Texas, I then began my professional stint with Brookshire Grocery Company. With BGC, I've had the opportunity to serve as a pharmacist in the stores and ultimately joined the health services team and worked corporately with compliance, incident reporting, and providing company-wide training to pharmacy partners across 3 states. Currently, I'm a full-time clinical assistant professor at the Fish College of Pharmacy at the University of Texas at Tyler. I specialize teaching in pharmacy law and practice management. I also serve as a consultant pharmacist and oversee 11 long-term care facilities and 2 assisted living facilities. Because of my pharmacy consulting role, I am able to offer P4 students a geriatric clinical practice site during their APPE experience. I've been a member of TPA for many years, but participating in the Pharmacy Day at the Capitol in 2019 changed my desire and drive to advocate for our profession. I currently serve as the faculty advisor for the UT Tyler a TPA ASP chapter and also serve on the TPA Public Policy and Association of Fair Councils. I want to serve on the TPA Board of Directors alongside with my fellow peers to help continue move the pharmacy profession forward in our great state. I want to be a voice, I want to advocate, and I want to meet with legislators to push topics and gain support for actions that will grow the practice of pharmacy in Texas. My vision for the future of pharmacy in Texas is to allow us to practice at our fullest extent, allow us to be the medication experts that we are trained to be, and allow us to serve our patients in the most convenient way at our pharmacies, and potentially eliminate an extra trip for them to their doctor's office if it doesn't need to happen. Thank you so much for your time, and thanks for considering my nomination to serve on the TPA Board of Directors. Hope you have a blessed day.
For Director, Position 2, Ashley Garling.
Hi, I'm Dr. Ashley Garling, HEB pharmacist and clinical assistant professor at the University of Texas at Austin College of Pharmacy. I have been involved in the profession of pharmacy for the last 23 years. I have experience in community pharmacy, corporate community, inpatient hospital, and advanced clinical services. This broad experience that I have has allowed me to see a lot of the day-to-day pros and cons in pharmacy life. And right now it's becoming evident that this is really a crucial time to be involved not only in the Texas Pharmacists Association, but advocating for pharmacists across the nation. The beginning of COVID-19 really put us in a great light as pharmacists, showing how important we were in the healthcare chain. However, as the last 2 years have gone by, pressures have mounted, and many chain and hospital pharmacies are battling low morale with staff and difficult working conditions. Now's the time to fight. Fight for the needs and the rights of Texas pharmacists, because not only are pharmacists suffering, but our patients and our communities are suffering too. We must protect our pharmacists to protect our patients' health. I am ready to put Texas pharmacists first for a safer and a brighter future. So let's use our voices, protect our pharmacists, improve working conditions, and safeguard the overall health of all Texans.
For Director, Position 2, Frank North.
Greetings. My name is Dr. Frank North, and I am an instructional assistant professor at the Irma Lerma Rangel College of Pharmacy at Texas A&M University. I am interested in serving the Texas Pharmacy Association Board of Directors because I believe in the future of pharmacy and pharmacy in Texas. I've served on the Texas Pharmacy Association Board as Speaker-elect and Speaker of the House, and most recently in 2019, just before the COVID pandemic, I asked for you to send me to the Texas Pharmacy Association Board of Directors as a director. And in that role, I anticipated embracing, educating, and informing pharmacists in Texas about the value of advocacy and participation in Texas Pharmacy Association and at the state level. I'm committed, and in my role, I've advocated for not just members of Texas Pharmacy Association, but non-members that are potential members. So I'm asking you to send me back to the Texas Pharmacy Association as a director so I can continue the work that was hindered or halted to a certain degree by the COVID pandemic outbreak. My vision for pharmacy in Texas is to be inclusive. We have to have a vision that works for pharmacists that are just not members of TPA, but also showing pharmacists and non-members how we are able to advance the profession to help them. I think with an inclusive mindset, we can increase the autonomy and the practice of pharmacists in all of Texas. So I'm asking for you to send me, Dr. Frank North, back to the Texas Pharmacy Association Board of Directors as a director for Texas Pharmacy Association. Thank you.
For Technician Director, Ashley Bishop.
Hi, my name is Ashley Bishop. I'm a pharmacy business consultant for J.M. Smith Corporation based out of Spartanburg, South Carolina. I've been a pharmacy technician since 2004 and hold background in hospital, independent retail pharmacy, along with having the opportunity to work with an independent pharmacy advocacy group for a period of time. As some of you already know, it's been a passion of mine for a while to fight for pharmacy, not just independent pharmacy, but pharmacy as a whole. I grew up in pharmacy and started working in a pharmacy in 2011. So it's been really important for me to not just continue to help the advancement of pharmacy, but to preserve previous pharmacists and previous predecessors' legacies and what they've built. I'm coming in with a little bit of a new perspective and exciting perspective this year. I have a son that's decided he wants to be a community pharmacist. And so it's had me thinking a little bit more on different ways that we can change and help preserve the future of pharmacy. And some of that is, just continuing the fight with making sure that pharmacists are allowed to practice at the top of their license, continuing to get pharmacy technicians engaged. I think as the practice grows and pharmacists are allowed to take on more responsibility and practice at the top of their license, there's going to be definite change for pharmacy technicians also. I would like to see, possibly some additional education for pharmacy technicians, just getting them more involved in TPA as a whole, and also working to help grow the association and help continuing to merge the different pharmacy groups together. We still made huge headway over the last few years, but we still have a few that are kind of splintered off, and continue to help break down those barriers. I'm blessed with the opportunity to speak with multiple pharmacists day in and day out. And, one of the big things that we talk about is advocacy and what their dreams are, what they see the future of pharmacy as. And it's often brought up, that they just don't have the time or opportunity to engage. So I think it's, coming up with additional ways, additional things that are missing to help bring additional value to TPA. Things have been made different this last year, and it's been amazing seeing the different changes that TPA's brought in. And there's just always more room to grow, and I would like to be a part of the growth and success and taking TPA and pharmacy to a whole new level for future generations. And I look forward to meeting you all in person soon, and thank you.
For Technician Director, Courtney Willis.
Hi everyone, my name is Courtney Willis. I'm a certified pharmacy technician. I live out in the East Texas area with my husband and our 2 kids. And if you've been on a Zoom with me, there's probably a good chance you've even met our dog Jake. He is our bloodhound that we rescued 2 years ago, and he likes to make some appearances on the Zoom calls every now and then. So I have been a certified technician since 2000, and I've been registered with the state since 2004. I currently work for Morrison-Dixon. They are a regional wholesaler that is based out of Shreveport, Louisiana. And I've been with them almost 7 years, and I've been in pharmacy since 1999. It is truly the only industry, career, job, people that I know, and I still love it even after all of these years. And that's one of the main reasons that I want to serve. I've been fortunate enough to be on the board of directors before many years ago, representing industry, distribution, and healthcare resources. And now in this technician role, I think it's another great opportunity for me to be able to give back to the profession that has given so much to me, to, help further TPA's mission and goals that they have. And one of the things that I truly hope to accomplish if elected is to educate our technicians that TPA is the Pharmacy Association. It isn't the Pharmacists Association. It truly is an organization that is there, and it is to represent all of pharmacy. Another thing that I would like to accomplish is working to further get our message out, especially legislatively, how to teach our pharmacists and our technicians and even their own patients how they can talk to their representatives locally and on the state level, even federally, to let them know issues that are affecting the pharmacy, whether it's DIR fees, whether it's reimbursements, whether it's a variety of contract issues that our stores are facing. We need to teach them how to become comfortable and confident and to speak to their representatives and to let them know that, pharmacy is experiencing a lot of challenges right now, and having that consistent voice and messaging coming to them from not only business owners, but employees and even their patients is going to be something that's very significant that we need to continue to push forward. My vision still continues to be that I really do think we need to have that pharmacy unification. We've made a lot of strides in the past few years of getting everybody up under that umbrella and funneling one solid message, especially during legislative session. That is still huge. We need to work to continue to further that, to be able to have that consistent messaging of the greater good of all of pharmacy. That is what we need to work on. And the other thing that I would like to really work on is to get that reinvestment of pharmacists and technicians coming back into TPA, realizing that TPA truly is there for them. TPA is working to advance the practice of pharmacy. They're not just here for a chain or a retail or an independent pharmacy or hospitals. They truly are there to represent all of pharmacy.
For Speaker-elect of the House of Delegates, Sean Ahmad.
Hi, my name is Sean Ahmad, and I'm running for TPA Speaker-elect of the House of Delegates because I truly care about this association and strengthening its membership. In this role, I will serve the members to ensure that our voice and will is heard and represented on the TPA Board of Directors. Not only am I looking forward to doing this by facilitating the House of Delegates when we meet, but also by encouraging engagement and participation year-round so that we get feedback from the members so that we know TPA is pushing an agenda which all Texas pharmacists truly want. As Speaker-elect and then as your speaker, I want to work with each of you and each local chapter so we can tackle issues together in regards to our association, such as finding new and innovative ways to increase membership, and also in regards to our profession, such as PBM reform and working conditions. I've been an active and dedicated member of TPA ever since I was in pharmacy school. My P4 year, I served on the TPA Board of Directors as the student chair. That year, I also won the Distinguished Student Pharmacist Award for my work in helping to create the TPA ASP Cup and also Sparks program. Since graduation, I've remained active and have served on several TPA committees. I've also served on the Board of Trustees for the Texas Pharmacy Foundation, as well as their Scholarship Committee. Last year, I was the keynote speaker at the University of Houston for their White Coat Ceremony, where I encouraged students to be strong advocates of our profession, both while in school and throughout their careers. Over the last few years, I've had the opportunity to grow professionally and see directly and firsthand how insurance companies, PBMs, and other healthcare providers impact our profession. I am committed to advancing pharmacy and finding new practice models that will allow pharmacists to be paid fairly for dispensing and other clinical services. I am currently working for Vital Life Pharmacy, which is powered by RenewRx. It is an independent pharmacy located in a wellness clinic where I work directly with other healthcare providers. Through this collaboration, I am showing how pharmacists can work and be integrated into a primary care system. Once again, I am asking for your vote for Speaker-elect. I am truly grateful for everyone's support and look forward to serving you.
For Speaker-elect of the House of Delegates, Tyler Hall.
Hi, I'm Tyler Hall, a pharmacist with H&B in Austin, running for the position of Speaker-elect House of Delegates. I am looking to bring my passion for public service and years of experience with the Capital Area Pharmacists Association to the Texas Pharmacy Association. I have been involved with CAPA since 2014 as a student member and worked my way to becoming the president in 2020. I became involved with TPA through HEB and CAPA since both organizations work closely with each other. This allowed me to see how impactful of an organization TPA is. Seeing and hearing the voice that TPA brings to pharmacy inspired me to serve. This led to me being a part of many different areas of TPA, such as financial and association committees, advocating at the Texas Capitol, and representing TPA at a fundraiser with a state senator. I am proud to be an HEB partner because of the support the company gives to involvement in professional growth and development in organizations such as TPA. I love to be challenged, and I see the position of Speaker-elect as a stepping stone in solving many challenges we face in the profession together as pharmacists, technicians, and technicians in training. I'm excited to apply myself and work with other passionate leaders to accomplish TPA's goals of advancing pharmacy and being a unified voice for all. I look forward to meeting you all, and thank you for your support.
To learn more about these candidates, please visit texaspharmacy.org/candidates.